Today, I've asked Dr. Lionel Corbett to join us. Dr. Corbett flew in from California yesterday, where he teaches at Pacifica Graduate Institute in Santa Barbara. He's a longtime Jungian analyst who is originally from England and got his degree in medicine at Manchester, right? And then came over here. I first met Lionel in the 80s at a place called Ghost Ranch, which is where Georgia O'Keeffe, her ranch was transformed into a retreat center. And the Jungians gathered there many moons ago, and we had a really lovely conference, and I first heard Lionel speak. And I love the way he talks about the nature of the psyche and how to use the psyche in our clinical work. So today we're going to really try to explore the religious function of the psyche, and we're going to start with Lionel having a short PowerPoint that he's brought with us to just sort of give us a sketch of kind of the areas that we're going to be focusing on, and then he and I are going to have a conversation together where we'll try to develop some of the ideas that you're going to see, and then we're going to invite you to join the conversation, and we'll have a dialogue with everyone here. So let's get started. So do you want to do your PowerPoint first?
Yes, sure.
And get going?
Thank you, Paul. Well, I'm going to talk about a certain type of experience that sooner or later you will hear in a psychotherapeutic setting. And I want to describe it because it's very important that the experience shouldn't be misunderstood. I'm going to try and make the point that this is a unique kind of human experience that's a spiritual experience or even a religious experience, and it shouldn't be confused with psychosis or some kind of abnormality, that this is a perfectly normal kind of experience. The only difficulty that you may have is that some people, when they have these kind of experiences that I'm going to describe, they're a bit shy about telling their therapist about it because they're afraid that the therapist will dismiss the experience or tell them that they were hallucinating, or that, as somebody said, what were you smoking, that kind of thing. But these experiences can occur by themselves, out of the blue, for no particular reason. And to understand the experience, you have to have a model of the psyche, which is a little bit different than the model that you might be used to. It's certainly different than the model that's used in cognitive behavioral therapy. It's a model that's used in depth psychology, by which I mean a model that takes into account the unconscious. So you see that the title is Numinous Experiences, and I should just talk a little bit about the etymology of that word. The word comes from the Latin numen, N-U-M-E-N, which is a Latin word that means a divinity of some kind. So here's the model that we use. We assume that our ordinary waking consciousness is like the tip of this iceberg over here. So this is everyday awareness that we're all in touch with. And then there's a thing called the repression barrier, and below that is a large amount of unconscious material that we can't voluntarily introspect and go into. And this is the level that the Freudian tradition deals with. And the Jungian tradition goes a little bit deeper and says that the psyche, or consciousness, has a deeper level, this level of the autonomous or transpersonal level of the psyche. And that's the level that these kind of numinous experiences arise from. So if you imagine that each of these things that look like a wave on the ocean represent a person. I seem to have lost my pointer. There it is. Each of these represents one person on the planet. You see, all human beings have this common level of the very deep unconscious underneath. Okay? And it's out of that level, that deep level of the unconscious, that we think that this level, this deep level, that we think that spiritual experiences arise. So the history, very briefly, is that the term was coined by a man called Rudolf Otto in 1917 in a book called Das Heilige, which means simply in German, the holy. This book became so important that it's still in print 100 years later. It's translated as the idea of the holy. It's almost unreadable, even though it's translated into English, because he was a Victorian scholar. So it sounds like it's been translated from the Latin, but it's still worth reading. And he wanted to talk about experiences like the experience of Moses at the burning bush. If you know your Bible a little bit, Moses heard the voice of God talking to him out of this bush, telling him to go and talk to Pharaoh about freeing the people. Or Saul on the road to Damascus, who had a vision of Jesus on his way to persecute Jesus. He saw a blinding light and heard Jesus' voice saying, "Why do you persecute me?" So Otto was very interested in those kind of experiences. And then Jung started to realize that if we listen carefully to everyday patients and people, or clients, I guess you call them clients, in psychotherapy, they do have these kind of experiences. They have experiences with this particular quality. And the quality is important, not the content of the experience. It doesn't have to be a particular Judeo-Christian content. It has to have this emotional quality. Otto said the experience is mysterious, fascinating, overwhelming, and something out of your everyday experience. So it's described in using words like awesome, dreadful, terrifying, uncanny. And when you have one of these experiences, you feel very small. You feel you're in touch with something much larger than yourself. So for Otto, these were experiences of the Judeo-Christian God. For Jung, when he took over this idea of Otto, it was simply an experience of the deep unconscious. Jung thought that all spiritual experience of whatever kind arises from this deep level of the unconscious, which is what we sometimes call the mythopoetic level of the unconscious. It's that level from which our mythologies and our religious traditions all arise. So the important point is the emotional quality of the experience, not the specific content. And when people have these kind of experiences, it may be a waking experience or it may be an experience in a dream. It's important to recognize that imagery or symbolic material from any religious tradition can appear in the person's consciousness. So if we go back, it's as if something from this very deep level comes up into personal awareness. So when Moses is talking to the burning bush, from the point of view of this model of the psyche, something from this transpersonal level of the unconscious has come up into his consciousness. That's the model that we use. So when you hear these experiences in psychotherapy, the important point is the quality of the experience, not the content. The experiences of being overwhelmed by something absolutely amazing, captivating, awesome, mysterious. And these things often produce religious conversions and that kind of thing. But the important point is that this is a psychological approach. It's not a purely religious approach, because in the psychological tradition that I'm talking about, we don't assume that these come from a transcendent God. We assume that they come from this deep level of the psyche. And there's a controversy that's gone on ever since this work began with traditional theologians and traditional religionists, because they want to restrict their way of experiencing the sacred to the imagery of their own tradition. They don't like the idea that you could have an experience that's very numinous, that has this divine quality, and may not be traditional at all. So, for example, a man had a dream in which he found himself in a temple worshipping a giant pig. And in the dream, he was absolutely overwhelmed with awe at the magnificence of this pig and how wonderful it was. And it was clearly a very profound experience. But when he woke up, he was absolutely horrified at the thought of worshipping a pig. And so when the Jungians hear a lot of experiences like that, and to talk about them, we say that you can't Christianize the unconscious. Imagery from any tradition, even a tradition that was not the one that you were raised in, can appear. Okay? Jung was particularly interested in these experiences because he felt that they had a healing effect. He felt that if you had some kind of emotional difficulty and you had one of these kind of numinous experiences, the experience would address your emotional difficulty and would help you with it. And I brought with me several examples of the way these kind of experiences can be healing. As I've said here, the experience, the healing effect seems to be produced because these experiences are so emotionally intense and so powerful that they're almost as intense as the emotional difficulties itself. It's like fighting fire with fire, that kind of thing. So since we're at William James, I put this little thing in to talk about the fact that William James was very, very interested in this kind of experience. And he had his own criteria. Otto said that these experiences were mysterious, tremendous, fascinating, awesome, dreadful. James had 4 criteria. He said the experience is ineffable. It's very difficult to put the quality into words. The experience is noetic. Noetic's an unusual word. It means it gives you new knowledge, new information that you didn't know about. The experience is transient. It doesn't last very long, maybe a few minutes. And the subject is passive. That's his 4th criteria, meaning that you can't control these experiences. You can't make them come and go. That's why we call this level of the psyche the autonomous level. It controls what happens. The individual is not in charge of whether the experience will come or how long it will last and so on. William James wrote some important work in which he said that our everyday consciousness, that little ego at the tip of that iceberg, is only one form of consciousness, and that there's a kind of a veil between that and this other level of consciousness. So Jung and James were quite close in their interest in this kind of work. James represents a very major strand in American philosophy and psychology. So I don't want you to think this is just a field with a very narrow level of interest. So the experiences can occur in different modalities, dreams or what we call synchronistic events. A synchronistic event is an experience where you've probably had this kind of experience where you're in a certain psychological state or emotional state, and then something happens in the outer world, in the physical world, that corresponds exactly to your emotional state. So you have an inner event, like a dream, say. Suppose you have a dream of a plane crash. You wake up the next morning and there's been a plane crash. Well, obviously, one is a psychological event and one's a physical event. They don't cause each other. The dream didn't cause the plane crash. The plane crash didn't cause the dream, but they coincide in time in a meaningful way. And when you have this kind of numinous synchronicity, it feels like an extraordinary sort of meant-to-be coincidence. Meeting the person you're going to spend the rest of your life with in some unusual way, that would be an example of a synchronistic event. Waking visions. A lot of people are shy about telling their therapist that they've had a waking vision. It's one thing to say you've had a dream, but it's another thing to say you've had a vision. It makes you sound a little crazy. So a lot of people will not tell their therapist about a waking vision until they've sort of checked out the therapist, because if they think that there's a very high incidence of atheism among psychologists and psychotherapists. So if you think your therapist is not going to be receptive to this kind of material, you're quite likely not to say anything, which is a pity, because very often the experience is going to cast some light on a psychological situation that you have in your life. And some people experience there's a whole strand of nature mysticism where, in all the traditions, where people have numinous experiences of the sacred or the holy in the natural world, in nature, which is why the ecological movement is so powerful, because people actually feel, when they have an intense feeling for spirituality in nature, they feel that damaging the natural world is a kind of desecration, although they don't usually cast it in religious terms. Okay, so I want to just give you a quick example of this, and then we'll have this conversation and we'll get into some of the details here. This is a dream image that occurred to a man who's a Roman Catholic priest. So he's about 60 years old. He's been in a religious order all his life. And he had a dream in which this figure appeared to him. Now, this figure is a well-known figure from archaeology and anthropology. It's called the Venus of Willendorf. And this was dug up. It's about 15,000 years old. It's thought to be the earliest known goddess figure in all our religious traditions. So here's a man who spent his whole life in this particular religious tradition having a dream about a pagan goddess. Okay? And what happened in the dream was that the actual figure itself is only a few inches tall, but in the dream she's absolutely enormous. And he's holding a communion cup, and he lifts it up, and then milk starts to pour out of the breast of the goddess into his communion cup, with the obvious implication that her milk, her nourishment, is sacred to him. Well, he woke up, he was absolutely horrified by this. Because what do you make of this when you've been in a tradition and you get something like this, which completely contravenes everything you believe in? But the experience was extremely numinous. She was a very, very powerful, fascinating figure in the sky above him, meets all Otto's criteria: mysterious, fascinating, tremendous. But this is what's meant by the phrase, you can't Christianize the unconscious. It told him, this is what James meant when he said it's noetic. It's giving him some information that really the divinity that he really worships is the divine feminine. And it's giving it to him in this very early form, the earliest known form. So here he is, who's a man who's been worshipping a male sky god all his life, and the unconscious saying, it's really the divine feminine that you should be interested in. Okay? That's what James means by noetic. It gives him makes him think in a radically different kind of way. Well, I think perhaps I should stop at that point and we can talk about it. Is that all right? So what, you want to take over?
Well, what I'm thinking is what would be really helpful to all of us would be to try to feel out how you work with the numinous in therapy. So you're suggesting, as Jung did, that the presence of the numinous offers a way to sort of release the person, I think Jung said, from the curse of pathology.
Yes, exactly. Yeah.
Right? And it has a capacity to sort of break up entrenched patterns because of the affective intensity that you're talking about.
Yeah.
So how do you work with that in therapy? How do you process that? How do you hold that with the person? How do you not interpret it and take it away, the experience away from the person, but sort of keep it as a living experience?
Well, that's very important. One thing I should tell you is that sometimes people will go to fundamentalist clergy with this kind of experience, and they're told that the experience is demonic. I had a patient recently who dreamt of Jesus as an old lady, a grandmother kind of figure. And her minister told her that this was obviously a dream sent by the devil, because it doesn't take a traditional form. So we have to rectify that. From the point of view of this model, an authentic numinous experience is not sent by the devil. It's just a message from the deep level of the psyche. So the first thing, to answer your question, is you have to validate the authenticity of the experience. People say, I had this experience. See, people have waking visionary experiences like this, and then they say, am I crazy? So the therapist has to validate the reality and the importance and the emotional significance of the experience. It's the emotion that's the most important thing. This is completely bypassing. I'm sure they've told you a great deal about cognition in your training. But believe me, that when you get into one of these emotional experiences, the emotion is far more important than any kind of cognitive approach to this. It bypasses cognition. It goes straight into the heart. So you track the person's emotional state. You validate the experience. And then you try to relate the experience to what's going on in the person's life. How is this experience relevant to you? What complex, what emotional difficulty is it addressing? In the case of this priest who had this dream, he was losing his faith completely. He was giving up on the notion that there was any kind of divinity or transcendent level or spiritual dimension. He was just thinking of leaving the order and just feeling despair that his life was just had been an illusion. And this really restored his sense of the sacred. So that's one of the ways that this kind of thing can be very helpful, just validating the experience. I've got lots more examples I can give you.
Let's keep going down this road for a few minutes. So the idea that it would release the person from some kind of pathology.
Yeah.
How does that work? I mean, how does it actually shift the person's experience? What is actually happening inside of the person?
Well, for example, this man was depressed. And he was depressed because he felt that his whole life had been a sham. I mean, can you imagine being a priest for 30 years or something and then deciding that you'd been living a lie in a way? I mean, he was horrible. He was in a horrible emotional state. So the experience directly addresses that kind of conflict or difficulty that the person has. But it's not a cognitive approach. It's an affective experience.
What about, for example, so think about it, in the case of a priest, it's easy to imagine ourselves into some kind of openness to the sacred experience.
Yeah.
But what about, I know you've written about the idea that painful affect, difficult affect, can be also a way of accessing sacred or spiritual experience.
Yeah.
And so put it in a kind of, let's think of it as a more mundane or in a less sort of, in a smaller example, in a sort of more in the sort of the evolution of a therapy. How does this access to the numinous actually work in terms of the therapy?
Well, you can't make it happen.
Right.
So you can have lots of therapies where nothing like this ever happens. The point I'm trying to make is that when it does happen, it's important to recognize it. That's all I want people to be able to do, is not dismiss this and tell the person, oh, well, you were hysterical, or you were hallucinating, or it was that piece of cheese you had last night, or that kind of, those are the reductive explanations for this kind, or you've got temporal lobe epilepsy. I mean, there are people who think that St. Paul on the road to Damascus had temporal lobe epilepsy. There are people who think that the Christian mystics like Hildegard of Bingen was said to have had migraine, so that all her numinous experiences were reduced to a migraine experience. Saint Teresa of Avila was regarded as a religious hysteric by people who don't understand this kind of experience. So the validation of it is very important, but it may not happen. I'm not suggesting that this always happens.
But let's say, for example, in a series of dreams, like with someone, where the psyche itself is some dialoguing with them, and there's a sense of this kind of intelligence outside of their own egoic experience.
Exactly. Yeah.
Right? So in terms of the therapeutic process, how do you work? I'm trying to convey, let's see, many people here probably haven't been trained in Jungian psychology, so how do you work with this kind of intelligence or this sort of information that's coming into the therapy?
Well, you know, in psychotherapy, you can't avoid your worldview and your anthropology, your view of the human being from being in the room. So if you accept that there's a spiritual dimension of reality, then that is in the back of your mind all the time. And you have to, I think, check out whether the person you're working with feels that way, or whether this is they might be an atheist, they might be a confirmed atheist, in which case this is probably something that you wouldn't get into. Although I have had people who came in as atheists and went out as believers as a result of this kind of experience. Because you're not telling somebody to believe something, they're just reporting their own experience. And all the therapist has to do is validate the experience and link it. And sometimes you have to link it to the therapeutic relationship. Now, that's a very important dimension. A few days ago, I heard a dream in which a woman is walking in a thick forest. The light is getting darker, it's getting later, and she starts to get frightened. And she turns around, and she's thinking that she's not going to go into this forest anymore. But on the way out, she meets a snake in the middle of the road that looks at her, fixes her with its eyes, and won't let go of the eye contact and won't let her go out again. Okay. Now there are lots and lots of ways of working with this dream. If you were to work with it relationally, you see, you could say, for example, well, I wonder if you and I are going into this forest together. A forest symbolically means an area where you can't quite see where you're going. We don't know what we're going to come across. We're working in the dark. And maybe you're getting a little anxious about what's going to happen if we keep going, and maybe you want to turn around. So you could work with the dream on a purely relational level like that. But you could look at the forest symbolically as a symbolic equivalent of the Great Mother, of the goddess in her vegetative aspect. In antiquity, trees and forests were always sacred to the goddess. And this woman had a tremendous mother problem. Okay, so you could say that she's gripped in the realm of the Great Mother. That she and I are working together in that realm, and it's getting a little bit too much for her. But the snake represents a very primitive level of the unconscious that's insisting that she stays in the work. So I work with it that kind of way. But that was a particularly numinous dream for her. Is that any help to answer your question?
That's really what. So what you're saying, a number of things that you're saying, that somehow you have to hold the affect that's there in the dream.
That's the central thing.
That's the central piece. So as a therapist, you are aware of your own experience of the affect in the dream, and perhaps whatever piece of your own experience is also stirred up. And that through this some kind of what you and I would call the interactive field, like our participation in the field itself, that is contributing to her capacity to stay with
it's
the
crucial.
work.
Yeah, and it's mediated through empathy. And you know, I don't know if this is stressed a lot in your training programs here, but in depth psychology, empathy is exquisitely important. It means the capacity to feel into and experience the emotion that the other person is feeling. It's incredibly important. The cognitive stuff, believe me, is much less important than they've told you. Really, the emotional field is far more important. So you the therapist, and your client are in this emotional field together, and you're both feeling the same thing. And that is a very powerful bond between the two of you, such that sometimes you can't tell whether the feeling is arising in you individually, or it's coming from the other person, or you're both experiencing the same feeling. But the empathic connection is incredibly important here.
Well, let's explore that a little bit, because so thinking about the people who are training here at the school and are learning, they're developing their clinical skills.
Yeah.
How does one develop a capacity to listen to the field, to really be aware of its presence and how to work with it?
Well, there are different levels of that. One level is your body. There's a phenomenon called somatic empathy, where the therapist's body resonates. It's like, you know how if you get two tuning forks next to each other, you strike one of them, eventually the other one will start to vibrate if it's close. The body is like a tuning fork. If you're sitting with somebody who's in a certain emotional state, it doesn't matter whether it's pain or despair or joy, your body, if you will allow it, will resonate in the same way. Sometimes you can, I had a woman I was supervising recently was sitting with a client of hers, and she says, suddenly I felt as though I was letting down milk to this woman, like I was breastfeeding this woman. Just that sensation in the breast. That's what's called somatic empathy, where you have a profound experience in the body, where the unconscious is expressing itself, not cognitively or verbally, but through the body. You can get a pain in the body, you can get the same indigestion or whatever that your client is feeling. All this is somatic, so be sensitive to your own body. Don't ignore the body. Okay, that's why it's fatal to be in the head when you're in the room. You've got to forget all the theory you've learned. You have to learn it, but you mustn't use it. That's the paradox. Okay? Because if you use it, the theory that you've learned will act as a barrier between you and a deep empathic immersion in the other person's experience. So the body is one way, and the other way is just the emotion that's arising in you. Now, it might be emotion that's split off. You might be sitting with a client who actually is in a rage but not in touch with it. And so you're sitting in the room and you suddenly find yourself unaccountably angry. Okay, we call this projective identification, which is a fancy way of saying that they're not in touch with their anger, so somehow it gets into you. Let's suppose you're sitting with a person and all of a sudden you feel stupid and incompetent and you don't know what you're doing. Most people in this field have had that kind of feeling, because most of the time we actually don't know what we're doing, but that's a good thing. You know, all the techniques and manuals that you have in your field are all defenses against feeling stupid and not knowing what you're doing. Believe me, they're all defensive. So very often we don't know what we're doing and we feel stupid and incompetent, and you think, well, I mean, either you are stupid and incompetent, or something is coming up in the field that's relevant to this other person. Okay, so this could be an example of what's called concordant identification, where this is a person who, as a child, was made to feel stupid and incompetent by hostile parents, critical parents, and now you're feeling the way he or she was made to feel as a child. Now, that's another example of an empathic field. Another instance might be that you're sitting with somebody and all of a sudden you start to think, why did I ever take this person on? How can I get him out of this room? What am I having for dinner tonight? You know, that kind of feeling where you just can't stand the person that you're with. If you haven't had that experience, you will, I promise you. So that could be an experience where the emotions that are arising in the therapist are the way that person's parents felt towards the person. I wish I'd never had this kid. How can I get rid of this kid? So now that's going on in the therapist. That's called a complementary identification. Now these are field effects. They're emotional field effects, okay? And they're very difficult to explain from a sort of a rational, positivistic point of view. The person induces unconscious material in the therapist. I mean, some people believe in telepathy. Other people think it's just induced in you in some way by body language and tone of voice. But that's the kind of thing you look for what's arising in you and see how it's... The other important thing is what Ogden calls reverie. Reverie means you in the session, don't worry if this happens, it's okay. You start daydreaming, okay? And you start to get, the therapist, starts to get imagery in your mind. Suppose you're daydreaming and you're thinking of suddenly a volcano pops up in your mind. Okay, what's this got to do with what we're talking about, something else? Well, that kind of reverie tells you something about the nature of the field that you're in. There's a rage about to happen. Okay? So that's another, so paying attention, the Freudians call this primary process. The Jungians just call it active imagination. But the psyche will give you imagery that will give you an illustration in your mind about what's going on. You're not, it's very important not to think of the two of you as in little isolated boxes. That's not the way it happens in psychotherapy. You're contained in this larger experiential field that you're both participating in, and you're both co-creating. And a lot of what's going on in the room is not just produced by the client, it's co-created by the therapist's attitude. That's very important. It's a long-winded answer to your question. Sorry.
Well, there's a lot of things to talk about.
Yeah, we should talk about some of this.
But I mean, there's two things. Let me just bookmark two ideas. One of them is that the idea that the numinous, then our joint participation in this field is, in a sense, we are participating in this sort of intelligence that is there, that is outside of our egoic awareness in some way. And so, as therapists, I think one of the things that you have to develop is a capacity to surrender to that.
Yeah.
And you're talking about leaving theory, but when you're sitting with someone who is very disturbed or is, in an agitated state, sometimes it's very difficult to surrender yourself to these types of experience.
Well, that's why you have to have your own therapy.
Yes.
Because if you don't have your own therapy, you can't handle the material that's stimulated by working with other people, especially if you have a similar problem. Maybe you had a mother or father problem, you're working with somebody who had a mother or father problem. Your own material can get very engaged. And if you haven't had your own therapy, you can't be helpful.
Yes, you've talked about that in terms of the wounded healer idea,
Yeah,
that it's inevitable, or that people are attracted to us in terms of our patients.
Yeah.
Perhaps that there's some piece of our own story that is in the room, and that unconsciously or for whatever reason, they find their way to us, and that it sort of creates the possibility, as I like to tell people, the possibility for two people to change instead of one.
Yes, exactly. That was one of Jung's main points. He said that psychotherapy is like a chemical reaction. If anybody's going to change, you're both going to change.
Yes.
It's exactly what you said. We both change. We're affected by. That's why using a manual is not helpful, because it stops you using your own creativity, and it stops you having a human response to the situation if you have to follow a manual. It's very harmful. It means that most of the people who need psychotherapy were subject to some problem agenda of their parents. Their parents had an agenda for the child and forced the child to behave a certain way. If you go and see a therapist who has an agenda for you, what's in this manual, you're going to have to submit yourself to somebody else's agenda. It's called a treatment plan, which is an absolutely pernicious notion, because it means the person has to submit to your agenda. You don't know what this person needs. If you trust this larger intelligence that's going on, you sit there and you wait and see what comes. This is called the maieutic approach to psychotherapy. Maieusis is the Greek word for midwifery. You're delivering this. When a baby's being born, you don't have much choice about how it comes out. You just sit there and whatever's coming out is coming out. You know what I mean? So it should be like that in psychotherapy. You don't know what should happen. It just comes out the way it comes out. You have to trust it.
Yeah. So I just want to keep going a little bit with the numinous idea. So you've written in a couple of your books that even with our wounds as wounded healers become our way into the numinous, right? And that the wounds themselves are numinous.
Yeah.
Say more about that? Like how does that work?
How is the wound, the therapist's wound?
Yeah.
Yeah. Well, if you've had a painful early experience with a parent, say, you are that much more sensitized to somebody with something similar. You hope that you've done enough work on yourself that you're not overwhelmed. But you can, it's called counter-identification. The therapist can sometimes get so lost in the client's material that they're useless. So that's when you're just wounded and not a healer.
Right, but I mean, the numinous quality is the part I'm interested in, that there's something numinous about it. In other words, numinous in the sense that it's opening you up to a larger experience.
The wound is a voice.
Yes.
The wound is a voice to the deeper parts of yourself. If you want to get to know yourself, one of the main ways is through your own wounding. I think that's perhaps what you...
That's what I'm interested in talking about, because I think it's very hard when people start out in training that, you know, it's very hard to imagine that their own wounds are going to be part of the work, or are going to be in the room even. That you're supposed to fix yourself and heal yourself, and then you're able to start working with people. But what I think you and I are trying to get to is that it actually doesn't work that way, that the wounds themselves remain even though they've been...
they're stimulated in the room. They're stimulated in the room, but then you know what area you're in. Yeah, they are very numinous, and you know, they never quite go away. I don't know whether that's one of the dirty little secrets of psychotherapy. Things get better, but they never quite go away. The old psychoanalysts used to say you can change the economics but not the dynamics. In other words, you can reduce the emotional intensity of a person's wound, but you don't change the wound itself. You don't get new parents. You know what I mean? You don't change the deep structures. You help a person attenuate the emotional intensity of what they've suffered. That's the best we can do.
And the other piece that I think Jung would say, and I think you would agree with, is that it's about developing meaning to the experience.
Yeah,
the role of meaning becomes very important.
That's incredibly important. So, for example, it's very common nowadays for people who had a drug or alcohol problem to, when they've gone through their own recovery, to become a therapist. This is very well known now. So that would be an example of a wounded healer who takes their own suffering and uses it in a meaningful way to help other people. That would be a good example of the use of your own difficulty in a meaningful way. Yeah. Jung thought that suffering which is meaningful is tolerable, that the suffering which is intolerable is suffering that's meaningless. That if you can figure out some kind of meaning, like, for example, helping others because of your own knowledge of this difficulty, that makes it bearable. Yeah.
One more piece of the other part that I bookmarked in my mind was this idea that feelings also become a way of accessing the numinous through our bodies.
Yeah.
And you're talking about the body as a tuning fork. But let's sort of extend that into this idea of the numinous. Like, how does our body function as a gateway to the numinous through affect?
Yeah. Well, that's a complicated story. William Blake said our emotions are an infusion of the divine. But I'd have to discuss what a complex was to talk about that. You sure I can do that? I don't want to put everyone to sleep.
You'll find a clear way to do it.
Okay. To answer this question about the importance of emotion, I have to just say a little bit about Jung's notion of the complex. I'm sure you've heard of Freud talking about the Oedipus complex. Everyone's vaguely familiar with that. Jung thought there were lots of different types of complexes, mother complexes, father complex. It's an area of your mind where you have an emotional difficulty or wound or painful place. You might have a feeling of inferiority, an inferiority complex, or something like that. Let's suppose you had a critical, angry father who constantly told you you weren't good enough. So this is now living on inside your mind as an inner voice telling you you're not good enough. And if you have that going on in your mind all the time, you're never happy. You're always on the edge of being miserable because you feel like a failure, because nothing you do is good enough. Hope I'm not touching anybody's difficulty here. But these are called, this is what we mean by a complex. In that case, it would be a father complex. You could have a mother complex. I had a guy recently said to me, my mother said to me recently, I never had any diseases until you were born. Okay, this guy has a mother complex. Okay,
It's organized around an emotional wound.
yeah, and it's commonly a mother or father or sibling or somebody who was emotionally important to you as a child. So well, I don't want to go into a long thing about this, but the important point about the complex is it's always got an emotional tone to it. You can't think about your mother or father or somebody like that without some emotion. So those are your complexes. They can be positively toned. You could have a very loving relationship with that parent. Then you have what we call a positive mother or father complex. Or it can be negatively toned if you have a hateful, angry parent. But the point is there's always this emotion attached to it. Now the important point about why is this related to the body? Because emotion is felt in the body. Emotion is not a cognitive thing. When you're angry or frightened or something enraged, you know, your heart pounds, you sweat, your muscles get tense, your mouth gets dry, your pupils dilate. Affect or raw emotion is felt in the body. The body is the organ of emotion. So these complexes are felt as emotion in the body with this kind of somatic arousal one way or another. Even joy or ecstasy is felt in the body. Well, for Jung, this deep, remember I put this diagram on the board where I said this is consciousness up the top, and then there's repressed material under that, and then there's this transpersonal level of the unconscious under that. Well, his idea was that when you're born with certain, what he calls archetypal potentials, which means the potentials for having certain kinds of experience that are common to all humanity. So all humanity is born with a predisposition to experience a mother, let's say. Now, that's called the mother archetype. Okay, it's represented in mythology as the great mother, the goddess in all the world religious traditions, the feminine aspects of the divine, and so on. But at the personal level, you have an element of that in you. And all the experiences with your mother, and the same is true for your father, all the experiences with your mother and father start to accumulate around that archetypal core. So you end up with human experiences, memories, fantasies, thoughts, feelings about your mother or father. But at the core of that is this archetypal core of the mother or father complex. And this is a spiritual principle. That's why it's represented in mythology as the father gods and the mother gods of all the religious traditions. But you have an element of that, all human beings have an element of that in their psyche. So when you have a complex with a very powerful emotional core, suppose that I'll try and make this alive for you, suppose you're sitting there and you're finding yourself getting angry with me, okay? Because I remind you of your father who wouldn't stop talking. Okay, or who was controlling, okay? And you're getting increasingly irritable and you can't figure out why. We say that a complex has been constellated or activated, but you're feeling it in your body. You want to rush out or punch or something. So one of these kind of structures in the mind, which are fairly permanent structures till you start to work on them psychotherapeutically, has been activated and you're feeling it in the body. But from the point of view of this model of the psyche, like this man had quite a severe mother complex, the spiritual dimension gets into the body in the form of the emotion attached to the complex. I can't make it any, is that clear enough?
Yeah, and the reason I want to emphasize this is...
I'm having an ecstatic experience from inhaling this.
Rather, I think it's easy to sort of distance ourselves from numinous experience if we think it only happens to, you gave the example of a priest, so someone who is a spiritual person who's dedicated their life to it.
Yeah.
What I'm trying to I think, help build a bridge to for everyone who works clinically is that the numinous happens in everyday life.
To ordinary people.
To ordinary people,
Yeah.
and it happens
Yeah.
through our feelings and through our bodies, and it
Yeah.
gives us a way into opening up a connection to something larger.
Something larger than ourselves, yeah, that's right. It opens you up to this larger, this deeper level of the psyche. So there's the personal level, what happened to you in childhood that you may not remember, that's called repressed material. But there's also this transpersonal level. Okay, yeah.
Yes, I have just one more question, and then I want to,
We should, yes.
or maybe we should just go ahead and I'll save my question. Sure, we can do that, and I'll come back to it. I'm not going to forget it. Yeah, so if you do ask a question, can I ask you to stand up, just so we can hear you really loud and clear? And if we need to, we'll repeat your question. But so what are you thinking? How are you making sense of all this?
Are you making sense? Yeah, yes.
I'm wondering about that idea of having a numinous experience that's demonic or devilish.
That's demonic, yeah.
And so I've been trying to make sense of it. It seems to me it might make sense for a person who needs to recognize that they have been hurt and who has defenses against that, like a person who avoids grieving. Does that make sense?
Yeah, that makes perfect sense. Yeah, and people do have demonic experiences, which isn't to say that there is a devil or demons in the traditional metaphysical sense, but they are aspects of the psyche that are terrifying and persecutory and damaging. And people do have those kind of experiences, and there are lots of accounts of people actually encountering demonic figures or dreams of demonic figures that torment them and persecute them. So that's one type of numinous experiences. I think that's an important question. Thank you. Yeah, this is not all sweetness and light. I'm very glad you raised this. One of the main differences between this approach, this is an approach to spirituality based on direct experience, not based on doctrine or dogma or tradition or the Bible or any particular church. This is based on your own experience. And one of the differences between this approach and traditional religions is that it assumes that the transpersonal dimension has positive aspects and negative aspects. What we call the self with a capital S, not the personal self, yourself, myself, which is the self written with a lowercase s. But there's a transpersonal self, which is this field that we're talking about. That has positive aspects, certainly, but it also can have very frightening aspects to it.
And talk about, maybe you could share a clinical experience of working with someone where that was evoked, that frightening aspect, and how did you work with that? Like, how did you manage that?
Well, I would try to relate it to the person's psychological life. Actually, this goes all the way back to Freud. He had a patient who had a demonic imagery in his dreams, and he decided that this was a symbolic representation of the person's father. It's called, I forget the name of the paper. And that's the way you have to work. You have to relate it to something in the person's life.
So you're making it, by doing that, you're trying to get it into a more digestible form,
Yeah,
rather
exactly.
than an overwhelming experience. You're trying to connect it and humanize the feelings.
Yeah, and you lend your own, the therapist lends his or her own strength to the client, because the material is unmanageable if he's or she is alone with it. So it requires what we call the therapeutic container, the relationship between the two people, to contain the intensity of the experience. That's why the therapeutic relationship is incredibly important for containing this kind of material. If you do very short-term therapy, you may not see this material very often because you haven't developed the container strongly enough to be able to contain the emergence of this kind of material.
Yes. Another question?
So I was wondering whether, based on Rowan James' definition or maybe your experience, that numerous experience can be both or either neurotic and or psychotic. Because I actually was thinking about a patient that I'm currently treating in a hospital. So I diagnosed him with schizoaffective disorder bipolar type, and one of the symptoms he has is hyper-religiosity, and also some of the sort of religious, mythical thoughts about like religion, religious figures. But I do not think those thoughts were just religious, kind of normal religious ideas. And so I guess my question is going back to my original question, which is, are you talking about, or the numerous experience, is this supposed to be just neurotic, and if it is, or should it be also, can it sometimes be also psychotic?
Yeah, that's a very important question. The answer is it can be either. And the way the model deals with that question is by saying that in psychosis, the person is stuck at this mythopoetic or level of the psyche, and there isn't enough ego strength to contain the material. So the metaphor that sometimes, they say that, for example, that the psychotic person drowns in the water that the mystic swims in. In other words, the mystic who's trained, who can go into this level and can come back into everyday consensual reality, whereas the psychotic just kind of falls off the boat, goes right down into this deep level and can't get back up and doesn't have the ego strength to contain it. So you get religious imagery, delusional religious imagery in psychotic people that's coming, in this model, it's coming out of this deep level. But you can occasionally get the sudden emergence in a dream or something of material from this level in people who are just walking wounded like the rest of us, just ordinary neurosis. So it can occur in both. I don't know if that answers your question, but it's very important not to, when people have this kind of experience as a waking vision, it's important not to confuse it with psychosis. For one thing, the experience is transient. They don't have affective incongruity or formal thought process disorder or other perceptual abnormalities, hallucinations or delusions. They have a discrete experience and then they're back to normal again. It's nothing like psychosis where the person stays disorganized and chaotic. But psychotic people do have these kind of experiences. It's just that nobody takes them seriously. Everybody assumes that, oh, they're just crazy. Well, they might be crazy and having one of these experiences. That's the point. If you believe that these are sacred experiences, why shouldn't the sacred appear to psychotic people as well as more healthy people? There are psychotic mystics and healthy mystics. There are all kinds of people have these kind of experiences.
I mean, you've talked about, thinking about that case, for example, that there are some people who can't tolerate sort of working with images or working with kind of numinous experience, and that they can't tolerate the as-if type of experience because they can't hold the intense affect. And so
that's right.
And that in those cases that you work with the relationship.
Yeah.
Right? So, I mean, I wonder if you could extend that a little further into a case like that. How do you work the relationship?
Well, with a psychotic person, it's rather different than. I mean, there are people who are not psychotic who can't work with symbolic material because developmentally they are pre-symbolic. They can't use metaphor or analogy. They can't work on dreams where something like this stands for something else. Everything is very concrete and literal. And you can't do this kind of work with psychotic people because the unconscious is already boiling over. The last thing you want to do is take them further into this. So this is not the kind of work you would do with psychotic people. With psychotic people, you have to find some way of containing the... most psychotic people are terrified. And actually the only thing that antipsychotic drugs are good for is that they calm down terror. They allow the person to cope with extreme terror. And sometimes you can do that through a holding relationship. But you notice that antipsychotic medication is not curative. As soon as you stop it, everything comes back. It just suppresses the terror. And it's the terror which makes the internal material seem to be coming from the outside, like hallucinations and so on.
I think that's very important.
Yeah.
So just about this case, so basically the psychotic religiosity basically has to do with, I believe, some sexual trauma, and but you know, like you said, well, for me it's more straightforward. I prescribe psychoanalysis. I mean, calm down those negative fear symptoms, and but you know, I think the origin was probably some fear and sexual trauma.
And it gets symbolized in the psychotic material. If a person tells you the world is coming to an end and has the delusion that the world is coming to an end, that is a way of talking about the fact that they feel like they're falling apart. So you can listen to the material and then communicate back what you think the person is trying to tell you in the delusional material. Do you know what I mean? I don't know if that's very clear, but you have to translate it, into this is what I think you're trying to tell me.
Yes.
And the attempt to understand is helpful.
Yeah. And contain.
And contain, yeah.
The terror.
But there are lots of people who need that kind of medication just to be able to sit in the room with you. So. But I'm more concerned with the more everyday kind of psychotherapy. Yeah.
Another question?
The man who was the priest and on the screen, the one you talked about earlier, it sounded like initially he didn't really feel comfortable with the image. That he was sort of...
He was amazed. He was absolutely amazed, yeah.
Well, amazed is better than appalled.
Well, he was appalled as well. I mean, he was horrified.
So in that case, in order for this to be useful or curative or helpful to him, he was going to have to come to look at it in a different way. And how would you help him to understand it?
Well, I would tell him, first of all, to take this experience seriously as what we call a message from the self. That there is a larger intelligence at work that's trying to give him a new way of thinking about his spirituality. And I would cast it in those terms. And if we had a good working relationship, you know, maybe he'd believe me. And if we don't, maybe he'll tell me, you don't know what you're talking about, and leave. But that's what I'm going to try and do. But I'm not going to tell him, oh, you're a dreadful heretic, you know, go to confession. And that's a whole different approach. Actually, he did leave the order. You get, these are personal symbols. If you have this kind of imagery in your dreams, you can have an altar which has this kind of material on it because it's sacred to you. It's not like the cross, which is sacred to millions of people, which is a collective symbol. These are highly individual symbols. And when I'm using the word symbol here in the sense of a connection to the transcendent dimension, something that links you to that. So that would be the, you would put this kind of image on your personal altar, even though other people would just be an archaeological artifact who wouldn't have any meaning to them. Well, have we wiped everybody out?
I have a question.
Yeah.
I have one more. Coming out of a case that I'm working on, because it's perplexing to many of us, I think. That, and you've talked a little bit about the role of love in the therapeutic relationship, and love as a transpersonal, sacred element of therapy.
Yeah.
Perhaps related to some of the empathy that you were talking about. And so, in thinking about that, and you've written a lot about it when the patient falls in love with the therapist. But the case that I'm thinking about has to do with the therapist falling in love with the patient.
Yeah.
And the inability of a therapist to actually hold on to themselves in the presence of the numinous.
Yeah.
And I think in terms of when we work in this style, if we're going to use the field and we're going to be open to experiencing this type of energy,
Yeah.
that it's difficult sometimes to hold on to yourself. And I wonder if you could speak a bit about that, and you know, and just your thoughts about that.
Well, I think love is crucially important in therapy. I mean, there used to be a prohibition against loving your patients. Do they still have that? No. Nowadays, I think it's essential. You have to love all your patients, otherwise you can't help them, or hate them. It's okay if you hate them, because you can figure that out. But you have to have some kind of strong feelings. But love is what gives the energy to sit in the room with tormented people. Otherwise, why would you do it? It's really a spiritual practice on the part of the therapist, because it's too demanding. Otherwise, you have to do it out of love. But that's not quite the same as falling in love with a client. Then if that happens, you've got two choices. The recommended choice is to get supervision. Go to a senior colleague and have a case consultation, and decide whether to work this out as a transference phenomenon. Is everyone familiar with the transference notion? That this is it's a repeat of your mother or your father or something. And try and work it out, or send the person to somebody else. It's unethical to act it out. You mustn't have sex with your clients and so on. That's understood. But you can't do nothing because you're ineffective in that. So I would first get a consultation, and I would consider referring the person.
Yeah, I think the thing that I'm thinking about is this idea that there are, by exposing ourselves to the field,
Yeah.
and with, in this case of this particular person, some kind of personal wound, that they get taken over by the experience in some way, by the numinous experience.
Yeah.
They get swallowed up by this larger experience. And this whole idea of how to hold on to yourself in the presence of this kind of experience. I mean, 2 weeks ago when Mark Epstein was here, we were talking about this idea of developing the capacity for synthetic awareness, that one can hold multiple levels of experience at the same time.
But not all of us can contain intense affect.
This is what
It's really about the ability to contain very intense feelings without acting out. That's what containment means. Containment means you feel something very intensely, but you don't act it out, and you don't withdraw. That's the other part of containment. You don't pull away, and you don't act out. You just sit with it, and it may be very unpleasant or difficult, but you just sit with it. And eventually it transforms with grace. Not always.
Any last questions that you're sitting with that you're going to regret that you didn't ask?
I do a lot of bereavement work, and one aspect of that is a group, mostly college age and graduate students.
Yeah.
And unlike the other college age and graduate students I see, this type of experience tends to get brought up in the group more than in individual sessions where bereavement is not part of what we're working with.
Yeah.
And I was just wondering if you had any insights on how this can be used in group work.
Yeah, I don't know very much about group work. What I can tell you is that these kind of experiences are more likely to happen when you're under great stress or grieving. And the kind of thing we see in people who are grieving is a visit from the dead person, a dream about the dead person, hearing the dead person walking around. And these are very common. I'm sure if you do this kind of work, you know these are very common experiences. You see the dead person at the foot of the bed and this kind of stuff, extremely common. And this depends on your own metaphysical commitments. You can say, oh, well, you're grieving, you're hallucinating. Or you can say this is a visit from the soul of the dead person. That depends on your own metaphysics. Do you know what I mean? What you believe in. So you have to find out what your client believes. It's a touchy area if you disagree. If you're an atheist and you think this person's just hallucinating and they think they've had a visit from the soul of their dead grandmother, you could get into a serious argument about it. So I think you have to go with the person's belief system. I don't know much about it in groups, but that's what happens individually. Do you know anything about that in groups?
I mean, just the experience of holding all the affect and the idea that it gets stimulated in a group experience.
Taking it seriously, what does it mean to you? That would be an important question, you know. Yeah. But they're very common, those experiences. They're just, people are shy about talking about it. But they're actually quite common. I've heard that 30% of widows have this kind of experience. That's a huge percentage. Yeah. Another question?
Well, I was thinking about the experience of grief as well, and wondering about, when you've described some sort of varieties of numinous experience that are sort of, that are quite supernatural kind of in their presentation, but I guess I was wondering too about the kinds of more everyday experience, like the experience of having a child or losing somebody beloved, that also tend to open us to some kind of more fundamental rather than personal aspect of living. And I'm not even sure what the question is here, but I guess would you classify that sort of thing?
No, that's a very important point that you've made. There are these special moments like childbirth or death or marriage. You know, these are sacred moments. Right. And that's when one can feel this as a kind of presence. Do you know what I mean? If you've had that experience at a birth or a death or something like that, you feel a kind of presence. I know it might sound a little spooky, but it's a real experience. The problem is that it doesn't come through the sense organs. You feel this sense of something happening, but it doesn't come through the five senses. The Sufis think it comes through the heart, that the heart is a kind of organ of perception of this kind of presence. But we're leaving the field of psychology here, sorry. So, but your point is important, because those are the moments when these things can happen.
Well, and I think even for those people who don't experience the kind of presence that you're referencing, there's still some kind of shift in the way that life is experienced. You know, I feel like a lot of people that I work with who are trying to live in the wake of a loss find themselves asking questions about what kind of life they want to live, for instance, right? Which is a different kind of conversation than how do I deal with my boss today, or how can I avoid having this argument?
It opens you up to this issue of meaning that we were talking about before. And when you're suffering intensely, sometimes you have to ask this question, is it worth going on? You know, people sometimes ask themselves, is it worth it? And that's an important therapeutic question. What's keeping you going is an important question when somebody's had a major loss. I think we could wind down.
Is there one more question over here somewhere? Oh, yeah, I do. My question was very similar to the one this man just asked, except he was more eloquent. I was thinking along the lines of either kind of ordinary life kinds of things where we might think that this kind of experience is hidden. Like it might be this kind of thing, but it's not even realized that way by the person experiencing it.
Yeah, but it's there.
Yeah, so we're smart. We can know that it's going on. But I do think that this other gentleman really explored that.
Yeah, he said it well, yeah.
Ed?
I think.
One of the things I'm struggling with a bit is I get the primacy of the affect and the strong emotions. It almost seems that the symbolism, while personal, is almost peripheral. And I'm wondering, you talked about providing a holding space for those strong emotions. And yet, when I try to blend this with that synthetic function of ego, maybe it's the failure of that synthetic function that doesn't allow people to let this percolate up, if you will. And yet, how important is it to find a comfortable label, description, synthetic, palatable story to help hold those emotions, and how much of that is in the dialogue, and how much of it can you just let it exist at the emotional level?
Well, sometimes people don't need much more than just validation of the reality of the experience. They need to know that the therapist is not going to dismiss this as crazy or hallucinatory or something. Other people need much more explanation. So that's a clinical judgment, I think. The symbol is important because it's the symbol which is associated with the affect. You can't really separate them.
Are you asking something about how to process the experience, something like that?
Well, I guess the thing is that this numinous experience becomes a key element. This is a rich signal and rich material for the work. And yet, I'm trying to put it together with the choice of symbol that emerges, the label that the client puts on it, the resonance, if you will, in this harmonic balance of wounds with the therapist. I don't have a clear question there, but I have a feeling that resonates, and I can't label it, so I'm not sure about it.
Yeah. I mean, you're asking, maybe one of the things you're asking is, it's so curious how the psyche chooses certain symbols. For example, the priest having the image of the Great Mother giving milk. I mean, how did that happen? Like, how did that get created? And how that kind of intelligence, how does it operate in such a specific way that bridges right to the person's life from this transpersonal level?
You can say to him, look, you had a huge mother problem. I remember this is a guy who, tell you about his mother problem. He had a very bad heart attack, and his mother said to him, how could you do this to me? Okay, so he had a mother problem. And I was able to say to him, look, your personal mother was a problem for you, but there is a divine mother whose able to nourish you based on this image. That's the kind of way it's helpful.
So it's interesting just hearing the word, you both use the word choice.
Yeah.
And so, as I hear, particularly seeing the diagram you present, I'm interpreting you to be saying that the symbol is actually not chosen by either the psyche.
No, it's not. It's chosen. No, it's chosen by the deep unconscious,
Right, it's emerging
not
out
by
of
the ego. Yeah,
transpersonal.
yeah. That's why we call this the autonomous psyche, because we have no control over it. It does what it wants.
The choice is how we interpret it or not. Or
Yeah. Well, we could just dismiss it. You know, just it was nothing but a dream, as if that makes it unimportant.
Yes.
I have a rather strange question. I mean, this is talking intrapsychically, and I'm wondering about the present cultural environment and what kinds of permissions people feel in different environments, and what kind of what is the construction of our current situation that also touches upon some of these issues, and symbolically in terms of fear, in terms of repetition, historic repetitions, in terms of yearnings. I mean, there are so many deep feelings, and I'm not even sure they're unconscious. They're actually almost too conscious and too at the surface. And how does this affect the way we perceive meaning and these stirrings?
Are you asking, if I could paraphrase, what's the relationship of all this intrapsychic material to what's going on in the outer world?
Yeah, I mean, I think, because I think that also has to somehow enter into the personal therapeutic relationship.
Yeah, that's a really good question. Well, of course, the outer world comes into the therapy room when people get scared about the political situation or the threat of nuclear war. It inevitably comes in. Somebody told me they have post-Trump distress disorder or something. So it certainly comes in. And figures like that show up in dreams.
We'll talk about that.
Yeah. So that's one way. And I think when people have this kind of experience, they behave differently in the world. So that affects the world. But I'm not sure how to answer you. Do you have any good answers to that?
I think about the role of, the level of anxiety that I think you're touching on, that's everywhere, right?
But we're also living in a kind of strangely religious environment as well. I mean, that also is heightened in a particular presentation.
You know, what people don't appreciate, for example, with North Korea, is that the North Korean mythology is that the Kim Jong-un family is the descendant of an ancient demigod whose name I can't remember because it's a Korean name. It goes back several thousand years. And that in the mythology of their country, he is regarded as some kind of continuation of that figure. And that's why he's venerated, or his family is venerated as a kind of sacred figure. And that's why offending him is an extremely dangerous thing to do. It's essentially a form of blasphemy. Now, I don't think there's anybody in Washington who knows that. There might be one or two people. But you see, knowing a little bit of mythology would be a big help, actually, to our politicians, yeah. But they're not going to call me about it. I think we could stop.
All right, well, stop. Thank you very much for coming, Dr. Before you leave, I just want to let you know that on September 15th, this coming fall, I'm organizing a day-long conference on September 15th next year.
29.
Yeah, in 2018, on Dr. Les Havens, and we're all kinds of people who have trained with him and know his work quite well are coming here to William James, and we're going to have a day-long real celebration of his contributions to the field. So put that in your calendars. Thank you all for coming tonight.